Hello everybody. So in today's video, we are going to be going over two batches of objectives. We'll be going over objectives 18, 19, 20, and 21. Objectives 18 and 19 are sort of bundled together, and then objectives 20 and 21 are also bundled together. So we are going to start with 18 and 19 first. This is pretty straightforward and simple. Objective number 18 is explain how the nervous system controls respiration. Objective 19 is explain how arterial pH, arterial partial pressures of oxygen and carbon dioxide, lung reflexes, volition, and emotions can influence your respiratory rate and depth. So we're talking about the different things that can control your respiratory system and how they control it, right? So we're going to start right here, right? And happily start with straightforward, your nervous system, all that kind of good stuff, right? Because we know that our nervous system controls most things. So your parasympathetic nervous system, right? Remember, parasympathetic is rest and digest. Sympathetic is fight or flight. And then your autonomic nervous system is blink, blink, breathe, breathe, the stuff you don't need to think about, right? So your parasympathetic nervous system, when you are resting and digesting, is going to cause bronchoconstriction, right? That means that when you are sleeping, it's going to close off and tighten up your bronchial tubes a little bit more. That way you don't accidentally breathe in stuff you shouldn't be breathing in, right? Your sympathetic nervous system, right, that's fight or flight responses, kick in and cause bronchodilation. Remember, if you are getting ready to run for your life or fight that bear, you need as much air as you possibly can. So your sympathetic nervous system reflexes are going to take over, and they're going to cause all of your bronchial tubes, like your trachea, your bronchi, bronchioles, all of them, to dilate or open big and wide to allow as much air in as possible. Remember, this is why if you are starting to go into anaphylactic shock, why they give you a shot of epinephrine. You remember that epinephrine is one of the hormones that causes you to go into a fight or flight sympathetic nervous system state, right? This is why an EpiPen, which has epinephrine in it, will cause you to be able to breathe and will stop the anaphylactic shock from your lungs closing up, because it's going to cause all of these tubes to dilate when you get that EpiPen shot, right? Your autonomic nervous system. We know that your autonomic nervous system already detects all of the chemical levels in you. Remember those carbon dioxide levels we were just talking about? And that kind of stuff. So your autonomic nervous system is also going to cause involuntary responses when things get suddenly blocked, like coughing. And it's going to keep track of your chemical levels to see where you stand with your oxygen and carbon dioxide levels for how much you need to breathe in and out on a regular basis, right? The pulmonary plexus, where the nerves formed, going down the hilum, that cause you to breathe. There you go, right? The region of the brain that detects all of this happy stuff, right, is called the pons. You guys may remember that from A&P1, right? But the pons within the medulla oblongata detects carbon dioxide and oxygen partial pressure levels within your bloodstream, right? That's its entire job. It's the chemist system of everything. It's going to detect your oxygen and carbon dioxide partial pressure levels. When oxygen levels get low, the pons is going to trigger inspiration or breathing in so you can gain more oxygen, right? When carbon dioxide levels get high, it's going to trigger you to exhale to get rid of more waste. Consequently, this desire to balance what it thinks is best for your pons is why oxygen is a prescribed medication. If you've ever wondered that and not understood why oxygen is prescribed in those big tanks and why oxygen, if you have a relative that has emphysema, that has an oxygen tank, they are prescribed that oxygen tank to be set to a certain number on the oxygen tank. This is a prescribed medication because you can overdose on it. If you overdose yourself on oxygen and you make your blood oxygen levels too high perpetually, your pons will actually decide, hey, we have good oxygen levels. We're peachy keen fine. We don't need to inhale right now because our oxygen levels are A-OK. And if your carbon dioxide levels are staying pretty steady, right, then that just means your pons won't trigger you to inhale anymore. So I know it seems super counterintuitive, but if you overdose that relative or an individual on oxygen, their body will actually get lazy and stop breathing because it thinks everything is fine and they have enough oxygen to get by. Which, of course, will trigger you to not have any oxygen, and you won't be breathing because it will have, decided you don't need to breathe right now. And you can actually suffocate by overdosing on oxygen. And I know that sounds completely insane and counterintuitive, but it's possible, and this is why oxygen is a prescribed medication. Because in a absolute worst case scenario, you can actually overdose somebody on oxygen to the point where they stop breathing because they have the oxygen in them. Which would not be pleasant for anybody involved, right? When your pH levels are wrong because of the carbon dioxide levels in your blood, your body is going to attempt to exhale out extra carbon dioxide, meaning the pons is going to try to trigger you to exhale more and exhale more frequently. Right? So this can lead to a panting kind of situation, right? Where you're trying to exhale more, but just bring in enough air so you can continue to exhale. So you may feel constantly out of breath, right? It is also entirely possible that emotion can override with your parasympathetic nervous system, and emotion can take over temporarily. So if an emotion, quote unquote, takes your breath away, right? Or you have a strong enough emotional reflex to something, it can also affect your heart rate and breathing. So if you are shocked by something, you may quickly breathe in and just hold your breath. If you're scared, you may hold your breath. If you experience a really bad emotion and you go into a panic mode, your heart rate may increase, right? Which is going to increase your breathing. So emotion can play a role in your breathing and how this is affected. This is also something that people use to control their emotions. When you are telling someone who is having a panic attack to take big, deep, slow breaths to try to calm them down, right? So emotion can be intertwined with all of this. Right? And this brings us to objectives 20 and 21, right? Objective 20 is differentiate between hypernia, associated with exercise, and hyperventilation. Objective 21 is describe how acclimatization to high altitudes can occur. So two separate things we're going to talk about, but both involve your respiratory rate, right? Hyperventilation is an increased ventilation when you breathe in and out more, independent of your cellular needs, right? So when we have been talking about hyperventilation, it means that you are increasing the amount you're breathing, so you're breathing in and out faster, but your cells don't necessarily need you to breathe in and out faster. Your body is just doing it as a reflex, right? This is the difference between hypernia and hyperventilation. So hypernia is just when you are breathing in excess quickly, right? So when you exercise, you are actively depleting your oxygen levels faster. right? That's the entire point of exercise. You are using your muscles more frequently than when you're just sitting on the couch watching Netflix because you got on the treadmill, right? So your body is consuming increased oxygen levels because you are exercising and your muscles need that oxygen to keep going, right? Your body will compensate for your lowered oxygen levels by increasing the amount you're breathing. So your body's going to compensate for all of this by increasing your breath rate. Right? So clearly when you are exercising, you're going to breathe more, right? Hyperventilation, though, is uncontrolled inhaling and exhaling, regardless of what your body actually needs. So you don't even have to be exercising. You may be just sitting on the couch and suddenly having a panic attack and you're sitting there hyperventilating. Your cells don't need the added oxygen. You're just freaking out and breathing quickly, right? That's the difference between the two, right? So hyperventilation is when you're breathing more but your body doesn't need the increased oxygen. And then the exercised hypernia is just you needed more oxygen so you're breathing more heavily than normal. Another thing that can impact all of this as well is altitude. And I know that seems slightly weird, but this is also how altitude sickness works, right? At higher altitude, we know that oxygen levels get lower the higher up you go in the atmosphere, right? And at higher altitudes, your body produces more of that BPG protein that I talked about in your last video when we were discussing things that determined how easily oxygen or gas exchange could occur from air to bloodstream, right? BPG was that biphosphate glycerol lipid. Told you we'd talk about it a little bit later. So at increased altitudes or at higher altitudes, your body is going to produce more BPG. And the entire job of BPG is to increase how quickly oxygen can dissolve from hemoglobin, which therefore makes it transport and access cells faster and easier, right? So at higher altitudes, your body needs to make more of this lipid, BPG, to enable oxygen to transport faster and better in hemoglobin and go back and forth better, right? So you need that BPG amount to produce, which is good, right? But that leads us to a couple of fun loopholes in life, especially with the Olympics, right? Right? So what ends up happening is if you are from a higher altitude, your body makes more BPG, which promotes the disassociation of oxygen from your hemoglobin so your tissues can get it. At sea level, you don't make as much of this BPG, right? Because the hemoglobin saturation is higher, but it needs to release less oxygen, right? The fun quirk of this is if you find a population of people that have lived and, due to heritage, for hundreds of years, have lived at higher altitudes long enough, their bodies may actually just naturally produce more of this BPG and more red blood cells, right? And as we talked about in our blood unit, if you find a group of people who have acclimated to higher altitudes like that, they're going to be better at sports and more efficient at carrying more oxygen, which is going to be more efficient for them to go through things like sports. This is why our Olympic teams practice in Colorado, and it's why we also look for people in high mountainous ethnicity type regions to perform certain sports. None of that is coincidence. We will happily poach people from those high-ranking altitudes, pay them to become American citizens, and put them on our Olympic teams, because it gives them a better endurance for the sport, right? If you remember us talking about that before. But yeah, that was your lovely short video on ventilation, hyperventilation, altitude, and all this sort of good stuff. I hope you have a wonderful day. And yeah, we only have one more video to cover for your respiratory system. Have a wonderful day.